Okay. Afternoon. Thank you all. Thank you all. Short notice, but I'm delighted to have an opportunity to be in touch and to chat with you and answer any questions. So let me just jump in and I think it's well known that I oppose the continuing resolution, the bill that came up yesterday, and I was very clear about why, because there's not one thing that was there to address the Republican healthcare crisis amid what I have been talking about for a very long time, which is a cost of living crisis. We're going to see more than 20 million Americans paying double, even triple their monthly insurance premiums. It's just a matter of weeks. People are getting the letters now. Several have got it. I keep talking about the young woman that I met with, Renee. She's from Milford, 2 kids, single mom. She got her letter, $2,000 a month increase more, $24,000 a year for health insurance. Who the hell can afford to do that? So, and this bill leaves families without a glimmer of hope that their costs are going to go down. So, energy prices up, grocery prices up, housing costs are up. There was a report a couple of days ago that 2/3 of American workers live paycheck to paycheck. So, the most important issue on their minds is affordability. President Trump says affordability is a con job. Okay. I will just say, and I said this yesterday, how more out of touch can anyone be, especially the president of the United States? I suggest that what he do is to stop talking to his billionaire and millionaire friends and holding Gatsby parties, and start to talk to Americans, to people who are struggling day to day. And what occurred here, as I think you know, the President Trump, my Republican colleagues, refused to address the health care issue. They avoided it, and so intent on avoiding it that they shut the government down. You know that the Speaker shut the House down 43 days, for nearly 8 weeks. He kept the House out of session, which is pretty extraordinary. But Johnson has indicated he's not going to deal with this issue. No interest in holding a vote on extending health care. And so, I view this as that more and more if I thought about what was happening, that what is going on is the Republicans are trying to repeal the Affordable Care Act. Now, they have been trying to do that unsuccessfully for the last 15 years. They have no plan, nothing. They haven't presented a plan in the last 15 years of where should we go on healthcare. And that's why I felt so strongly about this continuing resolution and being opposed to it, because I don't want them to succeed. I don't want them to succeed. Millions of Americans don't want them to succeed. And that's why we're going to continue this fight. Um, Look, got more than 2 million Americans are expected to lose their health insurance next year because it's become too expensive. And then look what they did in their big, beautiful bill with Medicaid. You guys talk to all kinds of folks, nursing homes, hospitals, the local advocacy healthcare groups, the clinics, the community clinics. They're in terror because of what is going to happen. Talk to hospitals about uncompensated care, which is going to occur. And the argument that some of my colleagues made in this bill and along the way was the continuing resolution didn't have anything to do with healthcare. Well, that is a damn lie, and I'm going to tell you why. Because there's 50 pages in this bill of healthcare provisions, and as I said to my colleague from Oklahoma, the continuing resolution is the jurisdiction of the Appropriations Committee. So if we're not going to take it up there, where else are we going to take it up? So, and not one of them really was talking about any relief for American families. I will tell you, but you found out, and we only found out after it happened at the last hour, folks who are going to get relief, thanks to this bill, 8 United States senators who are going to get this. And if you give me a moment, I'll give you their names. I will give you their names. Lindsey Graham from South Carolina, Bill Hagerty from Tennessee, Josh Hawley from Missouri, Dan Sullivan from Alaska, Tommy Tuberville from Alabama, Ron Johnson from Wisconsin, Cynthia Lummis from Wyoming, and Marsha Blackburn of Tennessee. Incredible. This is fleecing of the American people. Imagine that they snuck this piece into the bill at the 11th hour. This was Senate Republicans who did this. They put it in the bill. My colleague Tom Cole, the chair of the House Appropriation, knew nothing about it. I knew nothing about it. The Democratic leadership in the House knew nothing about it. It was the leadership in the Senate and the Senate Republicans who put this in there. And the provision is a payout of at least $1 million each. And I say at least because the way I think it's written, and I don't have the language before me, but for various counts of what what they view was transgressed for them, they can get 500,000 for each of the violations or the content that they calculate. So this is millions of dollars. And I'll make this contrast. The same time, what they wouldn't do, and this was I was part of this debate when we were debating this in the committee. The bill excludes a provision that would have ordered a plaque to be hung that honors the police officers who put their lives on the line to defend democracy in that same insurrection on January 6th. It is a contrast. Let me mention a couple of other things, and I just want to open this up. I'm witnessing, and I'll just say flat out, this is a lawless administration starting in January. The strength of the United States is that we are a nation of laws. That's what characterizes the United States. And what they have done is to fly in the face of the grounds on which the United States is established. It's lawless. Their corruption, it is unbelievable. And they do it at the financial ruin of American families. $230 million the president wants to pay himself from the Department of Justice. His allies, giving his Senate allies millions of dollars. $200 million for a pair of jets for the Department of Homeland Security, the Secretary of Homeland Security. The ballroom, $40 billion to Argentina. It's extraordinary what he is doing and the lawlessness of what he's doing. But I'm going to talk about just the power of the purse in a second. But what you also should know, and veterans also should know this bill fails to fully cover the Toxic Exposure Fund. That was created to support veterans who are exposed to burn pits, Agent Orange. We said we wanted to do this. We made this promise. The bill does not live up to the promise. This is flat out, it's advanced funding. We do advance funding. We have done that always for the veterans, and now we've done it for the Toxic Exposure Fund. They did say yes to advance funding for some portion of their medical care, but they refused to do it for the Toxic Exposure Fund, which leads me to believe that this fund is in jeopardy if something happens. But then they stand around and take pictures with veterans. So my colleague David Obey from Wisconsin, and this is a Catholic, it goes back to Catholicism. He says they pose for holy pictures. Catholics give out holy pictures at Mass, et cetera, et cetera. So look, the president has, this is about the constitutional power of the purse. The president has fired federal workers en masse. They have made life miserable for federal workers. Russ Vought, their OMB director, says, we want to make federal workers traumatically affected. Unbelievable that they would do this. And they've let go from January to now over 200,000 federal employees. They either force them out with a buyout or they just fire them summarily. Give me a break. I think I said this yesterday as well. Spare me your concern, and spare me the concern of the Republicans who, where have they been all these months when these people were being fired? certainly not giving a care about what the hell happened to them and their families. Then we've got the last point, they have been stealing from our communities. And I think we've given out this information in the appropriations bills. They have either terminated or delayed over $410 billion in funding that was approved by Democrats, Republicans, and the House and the Senate. And so they have illegally blocked authorized funds from being distributed. And I will tell you now, one of the most unbelievable acts of cruelty that I have seen in the 34 years that I have spent in the House of Representatives. And I've worked closely with Republican colleagues over the years on the food stamp program. What we do with food stamps is it is the best anti-hunger program in the United States. 42 million people. 360,000 people in the state of Connecticut. We've always funded food stamps, and we put aside a contingency fund. It's mandatory funding for food stamps. We put aside a contingency fund, in this case, $6 billion, which was there to be used. Trump voted for that in March to put in a $3 billion, but year before Biden put in $3 billion, $6 billion. Had nothing to do with opening the government. And I repeat this, all of you, and I hope you know it. I've listened to national commentators that I want to throw something at the TV because they don't get it. They have bought into what the Republicans have said is that you have to reopen the government to get food stamp money to flow. A lie. But I have never seen a president of the United States go to the Supreme Court to withhold food stamp funding for Congress lawfully approved 3 separate court orders to distribute that funds. And now what he wants to do is to say to the states and to Governor Lamont, take back the money and with the benefits that did flow to the state, it got out to people. Now take back that money. What in the hell is wrong? It's immoral. It is immoral. So look, this is a bill. Just let me sum up that. They strip food assistance from families and then deny their parents health care. That's what they are about. So what I concluded and why I voted no, bill fails to prevent healthcare costs from skyrocketing, fails to address the issue of affordability, and it doesn't keep our promise to veterans. It fails to protect the Congress's power of the purse, and it provides a $1 million jackpot to 8 Republican United States senators. So thank you for listening to me. Let me hear from you.
All right. One moment. If you have a question, go ahead and raise your hand or put it in the chat. All right. Looks like we're going to hear first from Jonathan Salant. Go ahead, Jonathan.
Jonathan.
Hi. Thank you for doing this. One quick question. You mentioned that the money for Trump to pay himself back from the Justice Department. Was that definitely in the continuing resolution?
No, I said what he's looking for is $230 million from the Justice Department. And some people have concluded that the senators got that put in, which would ease it to get him to get his $230 million. Now that's, I don't know that that's the case, but that's what is speculation.
All right. Anyone else?
I can't figure out how to raise my hand, but I have a question, so I'm going to chime in. I'm Andrew Rowan from NBC Connecticut.
Hi.
I got a message from a viewer.
I can't figure out how to put my hand up either, Andrew. I always have trouble with that.
I got a message from a viewer on Instagram this morning, and he was saying he was helping his self-employed sister try to enroll for Access Health. Yeah. And she was quoted $600 to $800 per month, and basically said that's just not affordable for someone making less than 6 figures in Fairfield County. And he said, and I guess my question to you is, what are our options?
they're going to have to shop around. They're going to have to shop around and look for the best price because the help that they were getting is no longer there. No longer there. You're getting calls. I am getting calls. That bears this out. And this is a now issue. And these damn fools who said, we'll deal with it, you know, after you open the government, we'll deal it with in December. By December 15th, people have to make a payment so that they can have insurance on January of 2026, on January 1st. So this is unspeakable. Unspeakable. And as I say, but it's part of their plan to get rid of the Affordable Care Act. We're fighting on the subsidies. We're going to continue to fight on the subsidies. You have to let people know that, but they should shop around now. Don't waste any time. Shop around now. But as our leaders said yesterday, this isn't over. We're going to fight on this. And you know, the wonderful piece of this is the American public is with us.
Do you think there's going to be a vote before December 15th?
You know, we don't know if there's going to be a Johnson it's not, it doesn't appear that it is on his radar screen to do something immediate about it. Thune talked about a December 9th or something or other vote. But you know, I have no faith and no trust in any of their promises or anything that they say. But Johnson has not even addressed that in the House of Representatives. Now, what we did do last night, and I don't know everybody, I think everybody was signing on. What we did, because we put in an amendment to this bill at the Rules Committee night before last. And there was an amendment, two amendments. One that said, let's extend the subsidies for 1 year, or let's extend them for 3 years. And then we established a bipartisan commission, or, you know, to address the issue. Both of those amendments were not made in order. So what the Democrats did was they initiated a discharge petition last night, which called for 3 years extension of the subsidies. So that's where we are, John.
All right, I see some comments in the chat, so I'm going to take a look at that quick. Oh, that was from you, Andrew. Okay, all right. So I see a hand raised from Bo. Bo, if you could unmute and identify yourself, thanks.
Hi, Congressman. This is Bo Erickson with Reuters Congress's team in DC. The shutdown seems to have increased animosity, to say the least, between Democrats and Republicans. So what is your confidence level that lawmakers can come together by the end of January to avoid another shutdown?
Well, you know, let me say this. I think you're absolutely right. And that shouldn't be. It should be that we could work in a bipartisan way. I have chaired and I've been the ranking member on the Appropriations Committee for a number of years. And I worked in concert with a Kay Granger of Texas, Shelby in Alabama, and Cole working together. And we've been able to pass bills. We had differences, but we came to a compromise. Our leadership asked for meetings going back to August. And the answer was no. There was one meeting. The first meeting that the president said he would do, he reneged on. The second meeting, you know, they were just, it was no willingness to come together in a bipartisan way. And, you know, just a couple of weeks ago, Jeffries and Schumer asked, you know, for a meeting. They just have said no. So I'm, you know, concerned. The other piece of this is we've got this time between now and January 30th, but there are 9 appropriations bills that have to get done. And those bills, while they've come out of committee, they haven't gone to the floor of the House, and they haven't been, they need to be negotiated. They need to be conferenced, all of that. So I am concerned about January 30th. My hope is that there could be, move as quickly as possible to deal with the premium subsidy and look at a way that we can extend it, because people are feeling the crunch now. And in the big beautiful bill, they cut food assistance by $186 billion, but they cut Medicaid by $1 trillion. That's in the law right now, that cut when that bill passed. So we got people in dire straits with regard to their health care. That requires immediacy to do something about. And my hope is that the pressure that comes from states that some of these members represent will move them in a direction of sitting down and being able to negotiate.
All right, thank you, Bo. Do we have any other questions? I see Andrew Rowan.
Andrew,
Hi
did I
again.
answer the question? The
One
last
one more, just because I got a statement from the Access Health CEO while you were speaking. He said he's concerned, obviously, that the subsidies have not been extended, but he remains hopeful. From your point of view in Washington, do you remain hopeful that they'll be extended?
I am always of the view that I suppose the answer to that question is yes. When I say hopeful, I want it to happen. People that you just talked about, what do they do? That's it. That is, it's inhumane. It's wrong. And we have to address that. So that's why, yeah, I'm ready, willing, and able to sit down anytime, any place, anywhere. Let's go. And we have to be hopeful, but we got to fight it out. We can't just say, oh my God, and by alchemy, something is going to happen. No. And the issue of healthcare and the affordability of healthcare and people's cost of living as regards the healthcare costs is front and center of our public discourse. That gives me hope.
Thanks.
All right, floor is open. Any other questions? All right, well, if we have no more questions, thank you all for joining. Rosa, is there anything you'd like to say to close out?
I would just say thank you. Thank you for coming aboard. It was, we just thought it would be a good idea to be in touch. But we can be in touch anytime. Just, you know how to reach King, you know how to reach the communications team that I have, and any of the policy questions as well that you might have. I want to repeat one thing. Please don't fall into the trap on food stamps. That said that it was necessary to open the government for the food stamp money to flow. It is misinformation. It is a lie. The money is there. I know. I appropriated the money. I voted for the money. The president signed the bill into law with the $6 billion contingency fund. It was about political will. And for the life of me, it's hard to say this, but it was weaponizing food for political purposes. That's just plain wrong. That's not why people got us, put their faith and trust in us to represent them in this body. Thanks. Have a great weekend, guys. Talk to you. Bye.